Hello, I'm Dr. David Hornbrook, the Clinical Director of Education at Keating Dental Arts in Irvine, California. Today I'm with Jim Kane. Hey Jim. He's the manager of our removable department here at Keating. Now Jim, you're doing a bunch of cool things because, I'm up there all the time, exploring and meeting with the technicians. You're doing a lot of cool things up there, but really what I want to do now is talk a little bit about the dentures. And I know that at Keating we have basically 3 categories of dentures, and we start with the KDA denture, which, why don't you go ahead and elaborate on that?
KDA denture is our economy denture. We use a simple plastic tooth, an economy base, a pore type acrylic. It's great for immediate situations and things like that. Okay.
Now, what does that include? So do you get bite blocks, wax rims?
Bite block, for setup, your finish, of course. If you needed a custom tray, that would be extra, but everything else is included in that.
Okay. And I've seen those. They're economy, but they're not cheap.
No.
Cheap as far as quality.
It's a good quality too. Yeah,
absolutely is. Again, we're using Ivoclar acrylic and good teeth, and as long as the prescription's done right by the doctor, and they fit great. And
absolutely.
They're a great working alternative to some of the more expensive dentures. So let's move forward and let's talk about our KDA Ultra denture.
Our Ultra denture is our top of the line. It uses Phonaris brand of teeth from Ivoclar. We use the Ivocap denture system to process that denture base.
Now, what is that, the Ivocap? What is that? How's that different from in dental school we're flasking this stuff? I mean, how's that different?
It's along the same lines, but it is cured under heat and pressure. Okay. So as the denture cures, new material is constantly being pushed in behind it.
Okay.
And the denture base is very, very strong, very color stable. It's an excellent denture. The finish and the fit are outstanding.
Okay, and then the teeth we utilize for that are
the Phonaris brand.
Okay, Ivoclar, which is
it's a composite tooth.
Absolutely excellent, beautiful tooth.
Absolutely,
as well as durable.
Yeah.
So that includes the bite blocks and it's kind of a kit. All these different dentures.
It's all inclusive. Your bite block, your try-in, a setup, of course, and then the finish.
Okay, so that's the Ultra. We have the KDA economy or basic denture, and then we have one in the middle, and that's the premium
That's
denture.
Our premium denture. That uses the Ivocap denture finish as well. We use the Ivoclar blue line of teeth for that. It is probably our most popular denture right now. The fit, the finish, again, that strong Ivocap base, and then the good blue line teeth. Okay,
so the steps along the way from what we get from the doctor and the pour up of the models to the mounting to up to the point it's actually finished is pretty much the same. The difference is both the premium and the Ultra is the Ivocap system, which is phenomenal, and then basically the teeth.
Yeah.
And the quality of the teeth.
The quality of the teeth.
Are.
Absolutely. Yeah.
Okay.
And they're all good quality teeth. The economy tooth as well. So
great. Okay, great. Well, thanks for spending the time with us. I appreciate it. Hopefully, you'll give Keating Dental Arts a try next year denture case.
Here at Keating Dental Arts, we also have our custom design abutments, whether it be from our Atlantis or our Nobel. We also design them here with the Strawman, and we send them out to Noble Biotech for the 3i encode and or abutments. We can utilize all these different scanners for depending on what the clinician would like to use. The Atlantis abutments, we actually scan design the fixture here, we put the flows on, and we send them out to Atlantis, the file to Atlantis to have the abutment fabricated. We have to approve every single design before it is milled out. So we have a great designer here, Bernie Rico. He will design them, he will alter them, modify them slightly. We sometimes get together and we overview some of these cases, and then we do some slight adjustments into the abutment so we get the end result is exactly what we're looking for. So that's one thing we can use with our Atlantis abutment. Atlantis, of course, has almost every single fixture out there. We also can do the zirconium abutments through Atlantis and the gold hue abutments for Atlantis when you want to have the all ceramic restoration, and you have the gold collar, which has a nice show through and a nice tissue contour and color coming through. You can't go wrong with the Nobel, Atlantis, or our Strawman, which we utilize all different systems. With the Strawman, we can design them here similar to the Atlantis. We can approve the design and they send them. We also can use the 3i and of course the encode, where you just take the impression of the 3i encode send us the impression of the scan body or the mapping collar, and we send it to them. They place the analog and send an abutment to us. There's a lot of companies that aren't well known, but we absolutely will take care of you. If you send us a case and I don't recognize it as a common brand, I'll make a phone call. We'll look it up, get on the internet, I'll make a call to a local rep or a rep that you've been working with, and we'll find out what it is. Like I said, there's so many systems coming out and we have to stay on top of it. And I think it's the communication that we have with a practicing clinician and the expectations of the patient, and then we can come together and have a good restoration with a great end result.